Hello, everybody. Hi. Um, this is Miss Felicia Nelson Davis here, coming to you. It's a very, very warm day today. Glad I don't have to go outside. Um, and this is concerning my post-op. I think let's see, I had the surgery July 5th. Today's the 14th. So I'm almost 2 weeks post-op from my first implant. Don't have a lot of energy, but I just wanted to come back because I have some readers and followers that are going through or getting ready to have this procedure done, and they want to know how I'm doing. Um, First of all, God bless. Hi. Um, I went and I live about 2 hours away from Duke University Neurological Hospital in Raleigh, North Carolina. Um, and I had my procedure done by Dr. Peter Grossi there. Um, as I was told, he was the only doctor there that is familiar or could even do the procedure. So I was lucky in that retrospect for him to be available and for me to be able to have the insurances and whatever to help me out with the surgery. If you've been following all of my all of my posts and all of my video from previous months, this was a lifelong illness, a spinal injury from birth, and it got worse over the years and um, grew into an excruciating, constant pain. And I ended up where I couldn't sleep. I couldn't stand more than 10 minutes without crying. Neuropathy pain from the waist down, and then it got worse from my right arm down. I took over my whole right side of my body, and my lower back is in excruciating pain. So what I decided to do was do the trial for the 7 days, which I did. Did a video on that back in I think March or April, one of those. Anyway, long story short, I did have the surgery for the permanent. The 7 day trial went fine, except for some right foot pain that was constant. Um, and now that I've had the implant put in for the permanent one, I don't have the foot pain. So I'm thinking maybe it was the way I was laying on the table, or maybe the position my foot was in before they put me under anesthesia. Um, Real quick, how am I doing? Um, they have managed to put in what they call the paddle, and it covers a more wider range of space in back there. Um, they made an incision at the top, like mid bra, where you would fasten your bra line. They made an incision there and inserted the paddle in between my vertebrae. Then the wires lead down from there, um, and I'll show you my incisions in just a minute because I think you should see the really neat job that he did. The incisions, I have two. I have one where the lead paddle is, and then I have one at the base of it's like my right hip, but it's kind of in the back area. It's not really in my butt, but it's kind of above it. It's a space there, and they implanted the device there. And I have an incision there. I have I got the hospital was 2 hours away, and so I had a little road trip to do, and they were aware of it. When I got there, I didn't even have to wait that long. I had some tests to go through, EKGs and stuff like that, because of my health history. But everything turned out fine, and so I was able to go ahead and proceed. Signed the paperwork, at bedside, and less than 30 minutes later, my scheduled surgery was for 11 a.m. They got me a little after 10. I was the first procedure for Dr. Grassi for the day. So this was July 5th. And it was pretty, pretty smooth. They kept me as comfortable as they could. Um, and it helps if you've been stuck a couple of times and you know where to tell the technician to get the blood and to start the IV. Believe me, it helps you. So if you've been stuck a bunch of times like I have, over 18 surgeries, you really, what you want to do, because the first thing they do after they get you in the bed and get you, scrubbed and everything, they start the IVs so they can give you all of your initials, and so they can, give you anesthesia and all that. And you want to tell them where to stick you. I mean, be as in much control as you can over the situation, because you're already feeling like, oh God, I prayed, and I've talked to my family, and this is, a last resort, which it was for me. So this was the absolute last surgery I was going to have, and I wanted to make sure. I had a little bit of nervous issue, but other than that, I was good. My husband worked extra hours so he could take off with me. My oldest son and his fiance came with me, and shouts out to them. I really appreciate having that support system with me. Um, my husband said he was even able to watch a monitor, and he was able to watch some of the procedure um, on a monitor. They had me on my stomach, flat on my stomach, on the table, and I do still have some right across my stomach and like the bottom of rib cage area on the sides. I can still feel some of the soreness of where they had me on my tummy. They decided, usually this procedure, they don't put you, all the way under sedation, but because of my health history, they went ahead and chose to put me under full sedation for the surgery. They were comfortable with where the lead wires um, were for the trial, so they just based, my surgery on that, and they just took the MRIs and the procedure notes and everything from before the trial, and that's how they placed my leads for this procedure. Um, the first couple of days, I dealt with um, trying to control my breathing. Trying to take deep breaths was really, really painful. Other than that, immediately, whatever mode they had it on, they set my device, which is here. I've got a little Apple iPad pod that they give you. Um, and you have to keep this with you at all times. Watch the battery, keep it charged. Other than that, you really got not much to do. Um, and I'll just turn it on real quick. There's other things that I've got up here. I've entered a passcode. Um, the box the box they sent me home with was this box right here. I don't know if you can see it, but yeah, it's from St. Jude's, and it had a little note on there telling me to buy my first post-op appointment at the office. Um, and the magnet comes in here, the iPod, your USB control, USB cord, and your charger all comes in this box. Okay. And the note on the box is telling me that I needed to bring with me my Apple iPod ID. So I had to create an Apple iPod account, an Apple account, because your device is on Bluetooth. Um, and basically, it has, when you press the button, it says patient control, and you've got to let it log in. It's on Bluetooth. So I think she said the iPod, the Apple ID helps them keep in touch with your device, keep in touch with you from where they are. So they'll be able to, if they need to change anything immediately, that they're able to do that with or without you being present. Okay, then the screen comes on. I know there's a glare, you guys. Sorry about that. There's a little blue guy. I can get it to show here. Okay, there's a little blue guy at the bottom. This green strip says the therapy is on. This all the blue on this picture is the area that I'm being covered with all of the with the implant and all of the burst, and it covers really well. As a matter of fact, the right neuropathy pain that I had in my right arm, I no longer have it. And the screen goes off pretty quick. I've got to put a passcode. I put a passcode in to keep the kids or anybody from bothering it for playing with it, because it's a very expensive device and you don't want the kids getting a hold of it. And I do have grandkids, um, but the little strip. Let me see. The little strip at the bottom. I'm trying to get that glare out of there. Um, Basically that little the blue strip at the bottom where the number is, right there, it you're able to, there's a plus and a minus button there, and you're able to, you know, boost the burst up to your level of comfort or turn it down. And there's also a continuous, if you want a continuous feeling of the burst, or if you want the burst cycle to the mode to be, a couple of minutes or whatever, you're able to choose that. I've got it on burst right now. I don't have it on continuous because the burst does fine for me right now. The burst stays on. I count to maybe 20 or so, and then it goes off. Um, I don't know. My family, they touch my skin and they say they're able to feel it when it's on and when it shuts off. So I've got it pretty strong because my pain was really high. But you may not need that level. Um, Also, um, the when I woke up, I was I don't know. I just felt like the pain was crazy. Um, in my mid back, and that is where she was saying I didn't even feel the lower part, which is where my all my crazy pain was at, where the cracked disc and all that stuff is at. I didn't even feel that area at all. What I felt was the top incision in the middle of my back, and it goes up like this, and the incision at the bottom goes across my back this way. And I'm going to show you a picture of each incision in just a second. But I wanted to tell you the middle of my back, it felt like somebody literally hit me in the back with a hammer or something. And she was telling me, um, she said, Miss Davis is going to spaz up. The muscle spasms were very strong. I'm still having them, but they're not as strong as they were. I did come home with, um, they gave me some Oxy 10s, and they gave me some um, muscle spasms. It says take 1 or 2 tablets by mouth 3 times a day as needed for muscle spasms, and it's tizanidine, if I'm not mistaken. But they are a godsend. She knew I had 2 hours to ride at home. She told me when I left the hospital to my husband to stop me somewhere to eat, and I was to take two of the muscle spasm like ASAP, because that's what I was dealing with, a lot of tightness, a lot of spasms on either side of my incision. Um, and that's really what I'm going through a lot now. And literally, when I tell you, you need to follow the rules. When they say no twisting, no bending, no reaching over your head, none of that, that you absolutely need to follow that, because the next couple of months, not even maybe 2 months, but maybe a little more, the wires are gonna move. You may not be able to feel them, but they will probably reposition themselves. And by the post-op appointment, they may even need to readjust your device. So it's been really hard for me. My bed, I've got to do some. I bought some pillows on the way home. We just stopped at Walmart and just bought a couple of firm pillows for me to sleep with, because the pillows I had at home were kind of worn out. But my bed is not really high. I don't have any handrails, so it's been difficult, turning myself over and finding a comfortable position. Really, I'm still not able to find any other comfortable position than my left side and on my back. So yeah, literally I'm still laying on the pain, but I'm glad every 4 to 6 hours I'm able to take the pain med, and then 3 times a day I'm able to take the muscle relaxers. So those two pills really have been helping me quite a bit so far. Um, my post-op appointment was supposed to be a week out, um, but because I live so far from the hospital, my original pain doctor is closer to where I lived. He's like 35 minutes away. So my surgeon said it would be fine if I did my first post-op appointment with him, with my other pain doctor that did the trial. That's closer. So I made an appointment with them, and they're so booked up. But I will get in on July 21st to see them. So um, I actually called them because I will probably run out of my muscle spasm medicine. I probably will run out of the tizanidine before my appointment. So I called to see, if they could um, put a reserve, call my pharmacy and put a reserve um, prescription in for me, just in case I need it. And actually, they called me, I guess they called back while I was asleep and told my son that they weren't able to get a hold of this medicine. Actually, um, since the doctor knew I had to travel, the pharmacy at the hospital just filled my prescriptions before I even left, so that was convenient for me. So I'm not knowing if the muscle relaxer that I'm on, if it's, the area that I live in now, or the drugstore that I use just don't carry it, or I've got to order it. I don't know the situation, but I'm going to call them in the morning because they left a message saying they couldn't give me the same med, that if I call them back, they would find something, I guess, compatible for me to use. So we'll see how that goes. But you guys, all in all, um, the birth the birth stimulator is working for me in the areas that I initially wanted them to work. I'm just gonna have to get through the muscle spasms and the pain from the upper incision where the lead paddle um, has been implanted. I'm really having a lot of pain there. I do have inside sutures. I didn't come home with any outside sutures or stitches, and they gave me instructions saying that you do not have to have any stitches removed. There will be a small amount of surgical glue on the incision, which is true, and it may start peeling off any extra glue after 1 week if it is still attached. You may peel it off yourself. I just told my care work, my daughter-in-law is taking care of me right now, um, and I've informed her. I think a couple of days ago I was able to start getting my back washed, really gently, and I've been applying some herbal oil to my back, to my skin, to keep it from itching because it started to itch. Other than it hurting and just being tight, I want to try to keep it as comfortable. You are to wear loose clothes as much as possible for easy access. Um, and the peeling actually on the lower incision has started peeling already. So it looks like half of it's, done and the other half's not quite ready. So probably after a couple of more applications, it'll be ready to completely peel off. So I'm not gonna rush it. The first day, the day after my surgery, I did have a little bit of blood, a little bleeding. Um, on the incision where the device is at the bottom, but it wasn't much, and it didn't last very long. The next day, I didn't. After that, I didn't see any blood at all from either incision. Um, I'm gonna try to show you. I don't know. I've got such a glare here. Um, I want to try to show you my upper and my lower incisions. Dr. Peter Grossi did an excellent job on my incisions. He really did. I didn't expect them to be so neat or so small at that. Um, but he really did a good job. So the outer is gonna probably heal really good after a few months. Um, Unfortunately, it looks like my healing process is gonna kind of cruise right through my wedding renewal of vows. Me and my husband are renewing our vows in September, and hopefully, if I rest enough and take care, I'll be able to um, have a really strong walk and walk down the aisle to my husband on that day and just enjoy, my bridal shower and all the festivities of the day. Hopefully, I don't have to lie down much. Um, I know I have to rest, but I'm going to try to, be ready for that. It's a special day, and I want to make sure that I am able to attend my own wedding. My goodness. Um, I'm trying to pull up some photos right now. Let me see. Um, I'm still trying to get used to. There are a couple of apps that come with the iPod. Um, and if you, like me, if you've got, family and I've got online business and other things that I have to do. So I absolutely added some more um, apps that I needed. Um, to to be able to maneuver and just do some things, even to log in, to make sure I can um, go to my files online, my medical chart, and request, whatever questions I have, or medicine if I need prescriptions, or if I just need to, re-identify with my appointments and make sure everything matches what they have and nothing's been changed and all that. So if your doctor office has a medical, or the hospital has a medical online patient portal for you to use, by all means, please use it because it does help. Definitely. Um, let's see if I can get these incisions up for you. I hope you don't get grossed out. But these are my incisions. This is the upper by my bra line. This is where the paddle is. I'm gonna try to get it so you can see. Okay, okay, this is the incision for where the paddle is on my upper back. It's right in between my spinal, the blade there. And that is also right above it is where my spine is curved. So the reason why they stopped there is because my spine is really had a real bad curvature at the top, have scoliosis, so I wasn't able to get the paddle all the way up. If I did, it probably would cover more, cover more space. But I wasn't able to do that, so that's fine. Um, and this is, let me see. I'm gonna try to get to the area that to the bottom incision where the device is. Yeah, it hurts a little, and I mean it was red and everything, but day by day it's changing. Okay, this is the actual incision. That bottom area right here is kind of hard. You can feel that's where the device is right there, and yeah, so that's the bottom incision, and basically I'm really sore. I'm moving really, carefully when I do move, even when I twist to get something, or, I try to reach, have everything at arm's reach. If I'm not able to reach it, I've got plenty of family in the house. If I can't yell, which I'm still not able to do, I text them, and they're looking at the text all the time. Um, we've created a group text, which is good with me, my husband, and the children on Messenger. So if we ever need to, see where everybody is, or check each other's schedules, or they just want to check on me, or I need anybody, I can just, Messenger, I can FaceTime them, or or I can just send, a message and someone will come. Everybody's been really great. I can still see the worry on their faces, but all in all, I think this is, since I used the outer 10 unit for over 15, 20 years, I thought this would be, a better band-aid for me because I've exhausted everything else that the Spine Center has to offer. Chiropractic, you name it, I probably did it, and I just ran out, and I was really tired of not sleeping. I think what I'm doing right now is actually catching up on the sleep that I never got for so long. Talking years of not sleeping more than 2 hours a night. Can you imagine that? So I'm getting naps in, and I'm absolutely not trying to fight it. I'm about to take one right now, as soon as I get off of here. But I've got a couple of friends that were going through this and they wanted some info I hadn't even put up after I put up the video saying that I had to make a decision. I never came back because I was just going through so much at home and trying to get everything with my business, current, getting the audio books started and doing auditions for that with people. And from my bedside, I'm doing all this and trying to get family stuff done, and just trying to keep my mindset, as tight as I could. So um, I didn't get a chance to come back, but I said I would after. Um, and like I said, my surgery was on July 5th. Today's the 14th. My post-op appointment is on the 21st, and I will come back and let you guys know how I'm doing. Okay. God bless. And again, um, this is going to work for me. And instead of the battery running out, it lasts for years. I'm already in love with it, and I'm not sorry I did it at all. So God bless. And if you're making this decision, do it for you. Do it for, try to get your life back, to try to get any normalcy with your pain, at least a little bit. Don't expect 100%, but if you can get at least a 50, 60, you know, percent of relief, go ahead and do it. Okay? I promise you, you will not. You will not. If they put it in the right places and cover the right areas, you will not be sorry. Okay? Love you guys. Um, Post any questions or whatever you want underneath this video, as with my others. I love you guys. Take care and peace. God bless.